last year is that the Attorney General says we don't need this bill. He says that the administration already has the power to regulate these clinics. So on that basis, I would move to PBI.
Okay, so there's been a motion made to PBI. Is there a second? The motion fails for want of a second. And there's a motion to report. This is an important matter. I don't want to cut off the debate. We've got all of about 3 minutes to get this done, and we have had this measure exactly the same come up last year with SIP membership. Is there anybody who would like to say something new? Delegate Morrissey.
Just this. I'm inclined to support Delegate Bell's bill, but I see some people standing there on the side, and I just think it's fundamentally unfair not to rush things.
I understand.
And I think if we could set this for another day where we have a hearing, and meaning no disrespect to your bill, because I'm probably inclined to support it as I have in the past, but I'd like to have a fair hearing on it, and I don't think, Mr. Chairman, that we can do that in the time remaining. We all have caucus meetings to go to, and so if we could just...
If y'all would like to speak, I'd be inclined to hear you. You're here now, and then see if we're sufficiently inclined to vote. That's my preference, but I'm not going to. Ma'am, step up. Just go ahead and step up, but you're here.
My remarks will be very brief. My name is Dr. Wendy Klein. I am a physician, and I spent my entire 25-year career promoting the health of women and girls in Virginia. I'm here before you because I believe this bill is indefensible. And in fact, as I'll explain, I think this bill is likely to make abortion not safer, but less safe. I say this because it should be obvious to all that using the rubric of safety is misleading. This bill is really not about safety, but about politics. There is no safety issue of which I'm aware. These clinics are already regulated by the Virginia Board of Medicine, the Virginia Department of Health, by CLIA, by OSHA, and let's be honest, these clinics are under intense scrutiny all the time by both those who are trying to protect patient safety and those who would like to shut down these clinics. They are always under scrutiny. The facts speak for themselves. The first trimester abortions, which are the only type that are performed in this outpatient setting, are among the safest procedures that are performed, safer than colonoscopies, endoscopies, outpatient plastic surgery, oral surgery, and yet we see no effort to regulate any of these other procedures. And why is that? The irony here is that we know with certainty that the earlier an abortion is, the safer it is. If we shut down many of the small clinics throughout the state, reduce access, as this legislation would do, it is more likely to delay the procedure, and that will translate into the possibility of diminished safety. I just find it fascinating that this legislation distorts the issue. I listened yesterday to Delegate Byron speaking about protecting patient autonomy and speaking against governmental intrusion where it is not needed. And I would say that this same principle certainly applies here. So on behalf of the women of the Commonwealth and on behalf of their constitutionally protected reproductive rights, I would urge you to defeat this bill. Thank you.
Thank you.
Good morning, Mr. Chairman and members of the subcommittee. My name is Jessica Honke, and I'm the Director of Public Policy for Planned Parenthood Advocates of Virginia. We're here in opposition to this bill. Abortion clinics are not regulated as ambulatory surgery centers because the Virginia Code does not require a physician's office to be regulated as such unless the office is used principally for performing surgery. Planned Parenthood health centers in Virginia dedicate 93% of their services to prevention. We offer cancer screenings, pap smears, sexually transmitted disease testing and treatment, and contraception to prevent unintended pregnancies. Only 8% of Planned Parenthood services are abortion services, and as you heard, the complication rate is less than 3%, and the serious complication rate is less than 0.5%. The real intent of this bill is to close our health centers and create barriers to providing high-quality, low-cost reproductive health care. For those reasons, I ask that you oppose this bill.
Thank you. Delegate Morrissey.
Jessica, Dr. Klein made a point, and I think I want to make sure that I understand it correctly. Did she list other surgical centers or types of surgery that aren't being regulated? Is that what I heard?
I would say they're not being regulated. They're physicians' offices, and we do adhere by regulations that meet standards enforced by the Virginia Board of Medicine and the Virginia Department of Health Professions. And you are correct. There are physicians' offices that perform colonoscopies, LASIK surgery, plastic surgery are all considered physicians' offices.
Okay. Question for the patron.
Dr. Morrison.
Here's my only concern. I'm not concerned just with abortion, but I want to make sure that there's equality and that there's parity and that other clinics that are performing surgery are regulated to the same degree that your bill seeks to regulate abortion clinics. In other words, I don't want to single out one entity or one surgery more favorably or unfavorably. Do you understand what I... And could you address that comment by Dr. Klein and Ms. Honke regarding the fact that there is perhaps other surgeries that are, she mentioned colonoscopy as one, and she listed several others, that aren't being regulated to the degree that your bill seeks to regulate abortion clinics?
Mr. Chairman, this bill seeks to regulate abortion clinics to the same extent that we basically regulate beauty shops and barber shops in Virginia, which come under the Board of Health. So, you know, we can go off in a number of directions here. The fact is that we always seem to turn this into a political debate, and it doesn't need to be that. If I could, if I could just read some excerpts from a letter from Mr. John Whitehead from the Rutherford Institute in a response to Senator Marston back in September. He said the proposed regulations modeled after current law in South Carolina are not designed for the purpose of causing sudden mass shutdown of existing facilities. Proposed regulations allow existing abortion centers to be licensed in their current structures, giving them a 2-year grace period before they're expected to come into full compliance. Proposed regulations even allow for the Department of Health to make exceptions to the standards where it's determined that the health and welfare of the community require the services of the facility, and the exceptions is granted. It will have no significant adverse impact on the health, safety, or welfare of the facility's patients. There's more to this. I'd be glad to share it with you. In the interest of time, I guess where I'm coming from is that this bill is about one responsibility that government has, and that's to protect our citizens. And whether or not you choose to have an abortion, that's not the debate here. What we're trying to decide is the proper level of safety, health and safety for women who do choose that option.
Mr. Chairman.
Delegate Sickles.
Ask the patron, Delegate Bell. What bad health comes have happened in the last year, last 2 years, last 3 years under the current regulatory system? And I have to say that you say a barber shop and being regulated a doctor's office, as they are now, are really not equivalent. I think that's just not a valid comparison. But what are the bad outcomes that have happened since last year when this bill was brought, or the year before when it was brought?
I don't have hard numbers, and I don't have that data.
Do you have any numbers? Soft numbers?
No, I don't have soft numbers either. I'm sure we can get them if you'd like to continue the debate.
I'd appreciate any numbers that we have that we've had bad health comes in Virginia. I'd be much more likely to support the bill. Thank you, Mr. Chairman.
Mr. Chairman, can I ask Dr. Klein a question?
I think Aura was first.
Mr. Chairman, I call the question.
There's been a motion to call the question that would have us move directly to the vote. The pending question was motion report, I believe. Yes, motion report. Any other motions prior to that? Okay, the motion on the table, which the question's been called, has been moved to report the bill. There's been no amendments. All in favor of the motion report, say aye. Aye. Opposed?
No.
Okay, let's count the noes. 2, 3. Let's count the ayes, then all in favor say aye. Okay, so it passes 4-3 from the subcommittee without amendment. Thank you, Mr. Chairman. All right, I'd ask staff, we have one more bill, Delegate Carrico. I don't see him here. Do you have any notion of what's going on?